Welcome to another Jonk Fuerscher, another returning Jonk Fuerscher, Petra Straga, with her project titled Acid Against Anxiety. Petra investigates how can lysergic acid diethylamide, LSD, be used to treat anxiety disorders. Over to you, Petra.
Anxiety. It's something that you, your sister, the person next to you may be experiencing every single day. I bet that a lot of young scientists that are presenting here or all the other days are also experiencing anxiety at the moment. In US alone, 22% of the population suffers from different anxiety disorders. They're very common and they interfere with how we function in our everyday lives. However, there are many negative side effects to the current medication used. And this is where LSD comes in. So LSD, lysergic acid diethylamide, or acid. It is a very potent psychedelic, and it works in a novel or marked way. Psychedelics are, however, stigmatized. They're seen in a bad light, and even many researchers themselves don't want to work with psychedelics because of the image that it will leave on them. But LSD may be very useful in terms of treatment of anxiety. And this is what I will present to you today. My project is called Acid Against Anxiety, and my name is Petra, and my research question is how LSD can be used to treat anxiety disorders. So this is a theoretical project. So starting off with LSD. First, it was discovered in 1938 by Albert Hofmann, and its actual properties were only discovered 5 years later. Its initial uses were aid to psychotherapy, and it was used in experiments for psychosis. And Albert discovered that it was a very potent psychedelic. However, the recreational use also started rising, so by 1968 it was banned. There are many different forms in which LSD can be taken in, including tablets, liquids, powder. As I said, it's very potent, so the optimal use would be between 100 and 200 milligrams only. It is very safe in terms of physiological effects, so there is no actual harm in terms of that, but there's some immediate side effects that may occur. For example, hallucinations or dizziness, but these only may last up to 72 hours. The biological effects, or the main effect that LSD targets, is this 5-HT2A receptor, and it basically works as a partial, so LSD works as a partial agonist at the serotonin receptor, which means that it stimulates the serotonin receptor, but not in the same, serotonin neurotransmitter, but not in the same, or not to the same extent or in maximum activation serotonin normally would. Other biological effects are increased plasma concentrations and increased brain connectivity. Some of the psychological effects are increased openness, in trait openness, trust, and optimism. The major effect is the decrease in anxiety. So for example, in a study by Carhart-Harris, there was a mild negative correlation between LSD, post-LSD, and anxiety. So there was a mild correlation of R, which was minus 0.47, which showed that as optimism increased, the anxiety after LSD decreased. Then comes anxiety. Anxiety is, as I mentioned, a prevailing mental disorder. It is common in one in every 4 people, and some of the very common anxiety disorders are generalized anxiety disorder, panic disorder, and social anxiety disorder. Generalized anxiety disorder is common 2 times more in women than men. Some of the effects include palpitations, panic attacks, tiredness, and stomach aches. Current treatments for anxiety include medications such as SSRIs, SNRIs, TCAs, and MAOIs, and of course cognitive behavioral therapy, which is what's the most effective, and its efficacy is up to 75%. The first-line drugs are SSRIs, and they're the first-line drugs in terms of treatment, and all of these drugs works in sort of a similar way by the process of reuptake. And this is where the drugs block the neurotransmitters, so the serotonin concentration increases in the synaptic cleft, so there's a higher concentration of serotonin. However, as mentioned, these drugs include a lot of negative side effects like headaches, dizziness, weight loss, and gain. And this is something that shouldn't be the case. If it's such a common disease among so many people, there should be better ways of treating it. There have also been studies on anxiety in cancer-ill patients. So for example, in a study in 2014 by Gasser et al., there were 12 patients, and there was a study on anxiety linked with life-threatening diseases. And their study showed that there was, in the active placebo group, there was a decrease of anxiety of only 0.6% in the mean, whereas the experimental group had a decrease of 3.6 points in the mean compared after only 2 sessions. So it shows a clear decrease in trend after they took in the LSD. So finally, where do these two meet? What are the advantages? What are the disadvantages? So clearly LSD shows that there is a decreased anxiety, but there are some acute effects like dizziness, like hallucinations. However, these are only short term and may last only up to 72 hours compared to the drugs that are currently used for treatment with anxiety. Also, there were a lot of positive effects like increase in optimism, trust, and some of the negative effects of current treatments with anxiety is that patients may relapse after they use these drugs, which is not the case with LSD because LSD is not an addictive substance. Another positive side is that it also targets the same neurotransmitters or receptors that current drugs do, and they show some sort of efficacy. So this is a good sign that we're on the right path to treating anxiety. So thank you very much.
Hello, Petra. Returning participant again.
Thank you. I'm very happy to be here.
Nice to see you here. So how did it go? Just a simple question for a start.
It was good. I think I was a bit nervous, but I think it went well.
Okay. Can you tell us a bit more about your motivation of choosing, we talked a bit before offline, but a serious topic, if I may say so.
Yeah, it's a bit more serious this year. I don't know. I was actually just looking into projects. I was looking for ideas, and then there was this. It was a study on cannabis and depression, and I think that that's something very common. I think a lot of people look for links in that, so I tried to do something a bit more different. So I chose LSD and anxiety. Yeah.
Okay. If I remember well, tell me if I'm wrong, but at the source of LSD, there was one guy who actually wanted to create something like that to have some effects on psychological health, and he developed this whole 100 different products that he tested on himself. There is a whole legend behind that. But in between, people started to give up on this idea because LSD became really controversial with the 60s and stuff. I have the feeling that in the last 10 years or so, people started to get an interest again in trying to solve mental health issue with LSD. How did you hear about it?
So I was just basically reading research articles, and then that's how I found out about it and the whole history. It started off with, as you said, Albert Hofmann, and
exactly, yeah.
How he first discovered it. And the funny thing is, he wasn't even trying to look for psychological effects or anything. He just accidentally tested it on himself, and that's how he realized.
Accidentally tested on himself.
Pretty much, he ingested it.
Just hold on, because I'm trying to figure out something like the guy in a laboratory and then accidentally.
Yeah, that's the thing. He doesn't even know how he did it himself.
Okay.
Maybe it went through his skin. Maybe he somehow digested it.
That could make sense.
Yeah.
Mm-hmm. Okay. Is it like a path that you would like to pursue, within the university career, trying to investigate effects of products for mental health and?
So I would like to work in research. So
yes.
Working on different either drugs or how they affect the body. So I think that would definitely be something interesting for me. Yeah.
Okay.
So based on your research, do you think it will be feasible that one day we will treat anxiety with LSD? Or do you think it's still controversial? You had the feeling while working on your project or today? Mm-hmm. Or what do you think it could happen?
I think it's still controversial, but it's getting better. I think it's getting there, and I think it could definitely be used in the future at some point. Yeah, for sure.
Okay.
It's going to be a noob question, but I see already, we know that, for example, for cannabis, there are some positive effects that can be used for a nervous system, but we encounter already a lot of barriers for the acceptance of using cannabis for therapeutic reasons. So I can't imagine people saying, okay, let's go for LSD. You know what I mean? Like, what's your feeling about it? Like, is it evolving now, or?
Yeah, I understand. I mean, people also see cannabis in a bad light as well, but I feel like LSD is even more scary just
Yes.
because of the name. And then again, if people aren't informed, they don't actually know that there's no, for example, physiological effects. Whereas compared to MDMA, like ecstasy, there are physiological effects. So there's a difference there. So LSD is actually pretty safe from that side, from that perspective. So yeah, I just think it's about informing people, and yeah.
And can we, so it's again a newbie question, but can we actually try to treat patients without having all those like crazy effects that people describe when they talk about LSD? Like just like focusing on some specific mental health issues and not having hallucinations or things like that?
I don't know how control, because each person reacts to it differently.
Okay.
So it's up to them. It's also up to the doses. But I think as long as it's in a under medically supervised setting, that will definitely make a difference. So in case there's any hallucinations or anything goes wrong, there are experts that can help with it.
Okay.
And it could cause addiction? Do you know?
No, because LSD is not an addictive substance. So that's a major advantage. Yeah.
Psychological addiction?
I don't know about the psychological addiction, perhaps, but the point of LSD is to only use it during in several sessions, and then it should be over. So it's not something that you come back to.
Okay, I see. Now, coming back down to earth about the contest. So you've been participating twice here. What would you say to someone willing to participate next year about the contest and your experience? And what did you win last year again?
I won the Taiwan International Science
The Taiwan.
Fair.
Oh, not bad.
Yeah, not bad.
Tell us a bit more about your experience in Taiwan in a few words.
So it was absolutely amazing. I mean, also the contest was really great. Everyone was really fun. It was a very, very educational, very culturally opening experience. So I think that was great. But also just the traveling, the meeting new people, the food, it was all really great. So I think anyone who doubts themselves and isn't sure about signing up, they should definitely go for it.
Yeah, so just for people to know, you've been accompanied there, and you've also been welcomed by the Luxembourg embassy or something like that, I believe.
Yes, yeah.
Yeah, so like you're treated like kings, basically. Okay, so tomorrow we'll find out maybe where you're going this year.
Yeah, we'll see. Yeah.
I hope you enjoyed. Thanks a lot, and I cross my fingers that maybe you will consider nonetheless coming back next year. We'll see. We'll be happy about that. But thanks a lot for coming this year again.
Thank you very much.
Good luck for tomorrow.
Thank you.